A few years ago, I was regularly waking up in the middle of the night with severe pain around the rib cage to the point where I was struggling breathing, and I was sort of a bit of a panic attack, really. It was a heart attack or something like that, but it wasn't. This has happened more than once, and the first time it happened, a friend of mine came over and babysat the dogs and what have you. Because I had to go to the hospital. The doctors sent me up to the hospital. They did all these tests, a blood test for heart disease and various other things, and it came back all negative. And no diagnosis of what was actually causing, because they didn't know. So everything's back to normal now, and it's not a worry, if there was a problem. But there wasn't one. They said there wasn't a problem. So I was getting this flippin' chest pain, and it's very common with fibromyalgia sufferers. No, chest pain. It's like the bottom of the diaphragm across there. Just below the diaphragm area, and it's like a sort of like a almost like a nerve pain. It's just like a deep ache, and it was waking you up, and it was crippling. You can barely breathe at times. What the fuck was going on? And it's unfortunately it just seems to be one of those symptoms, doesn't it? It can cause things like sleep apnea syndrome and all links. I wonder if I need a CPAP machine. I don't sleep that well. Some days I do sleep, sleep like logs. I'm so flipping knack, and it has no choice but I shut down basically. And other days when I'm a bit light asleep, and it's just like I just can't get my head down. I just keep waking up constantly. Just keep waking up, and it is obviously it's frustrating and it's obviously uncomfortable. But this rib pain and the chest, I believe it's called something like, oh my god, get it in my head. I should have wrote this down, shouldn't I? Someone to give him a C. Costo, Costo, John, Costa John Titus or something. Costa, I can't say that. Costa, Costa. Oh crikey, Costa chondritis. Costa chondritis. Anyway, apparently that's what it's called. This pain you get around the ribs. Now, I'm no doctor, as you probably tell. I'm a woodworker. That's what I do for a living. I make things out of wood, which is getting harder to do. But I've got to do it. I've got no choice. I've got no money. Apparently, that's sort of a condition of the chest, which obviously that's where it hurts, and it causes this like chest pain, and it can fool you into thinking you've got some sort of heart or lung problem. But the pain's literally down to this word beginning with C. you know. So you don't need to panic necessarily, but you need to be careful, making sure that's what it is, because you can misdiagnose yourself, and it'll fuzz you in the middle of a heart attack or something crazy. You know. Oh. Now it isn't life threatening, but it is all linked to fibromyalgia. Now it can get better in time. That as a symptom, but like all fibromyalgia symptoms, they can have flare ups, don't they? It's what apparently causes this particular pain is there's like a protective cage apparently around around your ribs. Unless you're Prince, of course, you have one removed. But anyway, and this pain's not from your lungs or blood vessels inside your chest, but more specifically, it's right in my head now, from one or more of the joints between the ribs and your breastbone, the sternum. Now, these joints they become inflamed and what have you, and if you have costochondritis, it's just something else you have to deal with. See, the thing is, we tell people this stuff, say, I've got this and I've got this symptom, got that symptom, what have you, and it's like, oh, crikey, what, really, whatever next. You've got absolutely everything. But what we have to remember is that fibromyalgia is brought on by your hormones. And the hormones are used to help control, deal with, or manage various functions in the body. And if the hormone's not right, if something's not going on right there, or there's hormone receptors, what have you, aren't receiving the hormones you're producing, well, then you are going to get problems throughout your body in various areas, but not necessarily always the same place up twice. No. Some people just get itching and, it's very irritating, and pins and needles and what have you as well. It's just for mild symptoms, but the pain, if you're getting the pain, it's horrible, deep, achy pain. It's quite intense, and it's crippling. So for some reason, whenever I get that, I get it when I'm asleep. It wakes me up, and I can't move. My dad, wife Caroline, she she got quite worried. It's often the first thing you think is a heart attack, don't you? So, and this pain is felt in the front of the chest area. Typically, it's sort of sharp stabbing pains. It's because it's nerve pain. That basically it's like nerve pain, and it's in some cases it can be really severe, intense pain, and they get worse. The pain sort of increases every time you move, because obviously it's in the joints between the sternum and the ribs. It's every time you move your body, but you're doing that all the while, aren't you? So the pressure on those affected areas, and it causes sharp, stabby pains. It's not pleasant. I tell you, it's not pleasant at all. The pain is usually quite localized though, and if you are suffering that as a symptom of your fibromyalgia, it's always going to be relatively within the same place. You see, it's going to be a common, a common area of the body that you'll be having your symptoms. But it is one of them. Like you can get some relief there, and it's worse with a flare up. Basically, you get flare ups because it does tend to wax and wane and what have you, and it can actually settle down. If it's basically change position, but even stress. If you're in a noisy environment and stuff like that, you're trying to get to sleep, but you can't because it's noisy. Or you're uncomfortable, shallow breathe, and all these things is all come together. You see, you tend to shallow breathe because every time you move your chest, you're flipping in pain. The thing we have to remember though, if there is no tenderness to the touch or what have you of this chest of your chest pain, it is actually unlikely to be the costochondritis. Big words for me, I tell you. It's unlikely to be that. So obviously you need to make sure you get yourself checked out by the doctor, just in case it is a flipping heart attack. See, that's the thing with anything like fibromyalgia. It's too easy to ignore the potential that might not be fibromyalgia. And then it's flipping dangerous. We've got to be so careful. It might sound a little bit trivial, but it's not, is it? It's just you could be your own worst enemy. Although I crave information and I do like to learn about stuff, but sometimes you can, sometimes too much information can be dangerous, especially if you're not equipped to actually analyze that data, that information. It's like when if you research something and you think you might have this, and you see all these pictures online, and you think, oh my Gideon, that's what's wrong with me, because all the worst cases are they're the ones that get put onto these websites, to not say exaggerate necessarily, but to make it more interesting. We don't all suffer to that degree, to that, that intense, disgusting images you find on Google images, yeah, like aliens busting out of your chest or something, that kind of thing. Yeah. Oh dear. Anyway, do you suffer with costochondritis? I don't know if I'm saying it right. Is it a complimentary? Is it an additional symptom to your fibromyalgia? Is it something that you occasionally, not necessarily all the time, you feel that that might be what you've got? Yeah, as well as your fibromyalgia or fibromyalgia is bringing it on. Leave in the comments down below. Please hit the like button and maybe subscribe to the channel, because then you get a warm fuzzy feeling in your pocket every time I upload another video. But for now, toodaloo.